To introduce and moderate this part of the evening, I am pleased to call upon Rabbi Elliot Dorff, the Director of the Rabbinical and Master's Programs at the American Jewish University. Rabbi Dorff's fuller bio will be found in the journal that you will receive at the end. Rabbi Dorff, please.
We are indeed going to learn some things tonight. We have two wonderful speakers who will be addressing us, each of them in turn, and then the three of us will be having a conversation. Since I have no idea what they're going to talk about, I really have to listen well. Professor Fred Rosner, whom I just met, but whose books I've read for decades actually already, is the former director of the Department of Medicine at Mount Sinai Queens Hospital Center in Jamaica, New York, and professor of medicine at the Mount Sinai School of Medicine in New York. He is also visiting professor of medicine at his alma mater, the Albert Einstein College of Yeshiva University. He is the chairman of the Medical Ethics Committee of the State of New York. Rosner immigrated to the United States from Germany, having lived in Berlin during the 1930s. Rosner was an undergraduate at Yeshiva University and then took an MD from the Albert Einstein College of Medicine. Dr. Rosner is an internationally known authority on medical ethics and has lectured widely on Jewish medical ethics. He is a prolific writer, having published 40 books, and whose bibliography numbers nearly 1,000 items. He is the author of widely acclaimed books on Jewish medical ethics, including Modern Medicine and Jewish Ethics, Medicine and Jewish Law, volumes 1, 2, and 3, Pioneers in Jewish Medical Ethics, Biomedical Ethics, and Jewish Law. He is the translator of Abraham Steinberg's monumental Encyclopedia of Jewish Medical Ethics. Dr. Rosner.
Thank you very much, Rabbi Dorff. Good evening, ladies and gentlemen. There is a Jewish tradition where one starts an evening by acknowledging one's host. So therefore, I would like to begin by thanking Paul Jesser for conceiving, organizing, and implementing this wonderful Shaare Zedek evening. I'd also like to acknowledge the presence of Mrs. Honey Amado, wife of the distinguished jurist whose life we celebrate this evening, widely respected Honorable Ralph Amado. The Amado family has been long-standing supporter of not only Shaare Zedek Medical Center in Jerusalem, but of many other causes, as you have already heard previously. I think it is particularly appropriate to have a program on Jewish medical ethics, and I am honored to participate in this program. This is a real celebration of the life of the honorable judge who was so respected for so many years. Zechrona Levracha. Jewish medical ethics is very appropriate discussion for Shaare Zedek event. Shaare Zedek Medical Center is renowned throughout the world for its combining two very distinct things. Number one, the finest of medical care that the world can offer, but with strict adherence to Jewish tradition and Jewish medical ethics. And that's what I'd like to talk about now for the next 10 minutes. Throughout the millennia, Judaism and medicine have walked hand in hand as allies, not as rivals. The mainstream of Jewish tradition has placed an enormous value on human life and health, has given human beings an obligation to preserve life and health, and has pursued a dual track of encouraging recognized medical therapy together with faith in the Almighty. Judaism has its place as a potent force in the moral advancement of humanity. Yet we are reminded that the study of Judaism and medicine is not a recent phenomenon. Jews have been studying, writing about, and practicing medicine for thousands of years. The Jewish tradition dates back to Mount Sinai and is perhaps the longest unbroken tradition that is still followed by its adherents. Because Judaism and medicine enjoy historical and intellectual kinships, It is only natural that Jewish law is best qualified to apply its reasoned, pragmatic rules of morality to the practice of medicine. The words of Rabbi Emanuel Lord Jacobowitz are as follows. For many centuries, rabbis and physicians, often merging their professions into one, were intimate partners in a common effort for the betterment of life. The perplexities of our age challenge them to renew their association in the service of human health, life, and dignity. Indeed, they challenge Judaism itself to reassert itself. Judaism and the Jews have, for the most part, rejected all varieties of dualism and rivalries between body and spirit. In fact, just the opposite is true. Judaism believes that spiritual progress can enhance a healthy body. Our ancients already had insights as well into preventive medicine and behavioral medicine. Originally, medical and spiritual diagnosticians in Judaism were one and the same, namely priests, Kohanim. As the separation of these functions progressed with time, we had physicians and rabbis. In the Talmud, such dual figures are cited, the most illustrious of which are Mar Samuel the physician and Todos the physician. In the Middle Ages, several very prominent Jews were both physicians and rabbis. Among the most renowned are Moses Maimonides, Rambam, and his son Abraham, Judah Halevi, and Nachmanides, known as Moshe ben Nachman, and many others. The reason why so many Jews chose medicine as a profession was that nearly all other fields were closed to them, either by papal decree or by strict outright anti-Semitism, or both. Only in the last 2 or 3 centuries have banking and business become available to Jews to choose as professions. Jewish Nobel Prize winners in medicine and other sciences far outnumber their proportion in the world's population, beginning with Karl Landsteiner for his discovery of blood groups in 1910, and more recently, the famous fugitive from Nazi Germany, Albert Einstein, for his theory of relativity. Many other Jewish physicians and scientists are Nobel laureates. Now to Jewish medical ethics. The emergence of Jewish medical ethics as a distinct subspecialty within the Jewish thought is a relatively recent phenomenon. The late Chief Rabbi of the British Commonwealth of Nations, Rabbi Lord Emanuel Jacobowitz, his doctoral thesis was entitled Jewish Medical Ethics and submitted to the University of London in 1955 and published first by New York's Philosophical Library in 1959. This was the first use of that phrase, Jewish medical ethics. This landmark monograph is perhaps a revolutionary publication, not only because the term or concept of Jewish medical ethics was unknown at that time, but the subject itself had rarely been explored and left without any literary or scholarly expression in any Western language. Physicians, medical students, and their other interested parties had no writings to consult to familiarize themselves with Jewish views, even on such elementary topics as abortion, contraception, euthanasia, autopsy, end-of-life care, and organ transplants, among others. Only a handful of people, mostly rabbis, could consult the original Hebrew or Aramaic texts scattered throughout rabbinic writings. Rabbi Jacobowitz was also outspoken in the House of Lords, where he was the first Jew appointed to the House of Lords in 500 years. There he preached the traditional values of religion and morality, the importance of ethical conduct, the dignity of labor, and the primacy of family. He was a brilliant communicator with an elegant command of the English language which matched his majestic physical appearance. In a speech he delivered in the House of Lords against a plan to allow commercial activities on Sundays, Rabbi Jacobowitz said, "The loss of the Sabbath will deprive Britain of the last vestiges of spirituality and sanctification." The silence in the House of Lords was broken by an Anglican admirer who shouted down from the gallery, "It takes a Jew to tell you that." At the establishment of Rabbi Emanuel Jacobowitz Center for Jewish Medical Ethics at Ben Gurion University in Beersheba in 1983, Rabbi Jacobowitz said in part, "Jewish doctors ought to have some idea of where Jewish teachings differ from commonly accepted norms of medical practice. For instance, the reluctance to inform patients of a fatal diagnosis if there is the slightest fear that such information may cause physical or mental trauma to the patient. Or the need to set aside a patient's desires and consent in order to save a life. Saving of human life takes precedence over all biblical and rabbinic commandments. The limits of professional secrecy when overriding third-party or public interests are at stake. Undisclosed genetic defects in a person contemplating marriage, or suppressed medical records liable to cause grave harm or public hazards through violence, crime, and illness. All these cases, the teachings of Jewish ethics are quite distinct, and Jewish doctors ought to be aware of them. The medical literature is now replete with reports on various aspects of medical practice and medical ethics. In summary, the Jews have participated since antiquity throughout the history of mankind, and especially in the Middle Ages, when illustrious rabbi physicians such as Maimonides, Nachmanides, and Judah Halevi flourished, have always held medicine and public health to be the cornerstone of Jewish tradition and medical practice. For the last 2 centuries, doors have opened wide to give Jews access to many endeavors and, of course, the study and practice of medicine, based on biblical and rabbinic laws and mandates. Jewish medical ethics as a distinct entity was inaugurated in 1959 by Lord Emanuel Jacobowitz in his now classic work entitled Jewish Medical Ethics. Several entries, Catholic and other secular medical ethical systems have been evolving over the years and have many publications to their names, whereas Judaism lagged far behind that, which has now been corrected with the publication of numerous books and monographs and numerous conferences on Jewish medical ethics. But the secular view and the Catholic view includes the general principles of autonomy, beneficence, non-maleficence, and justice. The entire field of biomedical ethics was catapulted to the forefront by scientific and technological advances that have been occurring over the recent past. Theologians and biomedical ethicists have not yet caught up with their ethical assessment of these rapid scientific and technological advances in neonatal care, end-of-life care, resuscitative measures, organ transplants, assisted reproduction, only a few of the topics which require intense religious, moral, theological, philosophical, and legal discussion and analysis. Thank you very much.